Thank you, Christian, for giving us an overview of what we will be discussing. Now, to better understand what burnout is and how to avoid it, we are going to start with the general definition of what burnout is. It is defined as a syndrome characterized by exhaustion, cynicism, and reduced effectiveness. Morenet from US Today has reported general findings of burnout. It is found that 95% of all organizations are affected by it. It is also found that only 33% of individuals are satisfied with their jobs. Same-day surgery has also conducted a study of burnout. Their findings show that 37 to 50% of physicians, depending on which area they specialize in, have experienced burnout. The highest percentage of 50% is found among general surgeons. Nurses also have a very high percentage of burnout. It shows that 40% of nurses report that they have experienced it. The emergency room is where we can find these employees. The ER nurses will work anywhere from 12 to 18-hour shifts 4 to 5 days a week. Physicians can work 12 to 36 hours for one shift. During this shift, they're going to be introduced to many patients. A lot of those patients are going to have negative feelings toward these employees. It can be because they waited too long to see the physician, they don't agree with what the physician found or his diagnosis, or it could simply be an addict who didn't get their fix from the physician. The nurses have it worse. They are dealing with these patients the most. And not only are they getting their attitude, they're getting negative attitudes from physicians as well. Physicians will become negative due to these patients, or it could be because they're not pleasant people to begin with. Either way, it affects the nurses, and all of this will cause burnout. Burnout also has side effects. They will have personal and professional repercussions. Personally, employees may end up with broken relationships, may have alcohol and substance abuse, become depressed, or commit suicide. Professionally, there will be a decreased quality of care, patient satisfaction, professional effort, and the organization will have lots of turnover. Psychological science has given us 3 types of burnout. The first type is overload. This is when the employee will work towards success until exhaustion. It also creates an environment where the employees vent about the workplace. The second type is boredom. This is where employees lack personal development. This is also when employees will start distancing themselves from work in their workplace. The third type is worn out. This is when employees are giving up due to the stress that is found at the workplace. These are also employees who want to achieve success but no longer have the motivation to do so. Schoenfeld has given us different ways of how we can try and reduce burnout in the organization. The first one is acknowledgement. It is extremely important for the organization to acknowledge and listen to any issues that the employees are having. Organizations must show that they care about the issues and their employees. They must show that the employee's position is important to the organization. Many times, organizations will treat their employees as if they can be replaced by any warm body. That's extremely inappropriate and uncalled for. The employee must feel like they are appreciated and that they are important to the organization for it to continue to grow. Another way is by having a positive environment within the organization. Anything within the organization that is negative, that can be controlled, needs to be changed. By changing things that we can control, we will change things that we can't. A patient may come in with negative attitudes all the time, but if you speak with them always in a positive way, eventually they will turn around. They will start speaking to you in a positive way. Another way is by giving them additional training. If you send them to programs to improve their skills, they are learning, it improves their attitude, and it also gives the organization a better employee. Also promote knowledge sharing. This again will give you a better employee, but you're also giving them coworkers and colleagues to talk with about different issues and different ideas. Another way is to send them to programs to motivate them. Sending them to motivational speakers will help their attitude. Their positive attitude will be brought into the organization, and the organization will be better in that way as well. All of this can help reduce burnout. Now that we've learned what burnout is and how we can avoid it, let's head back over to Christian's presentation and she'll wrap everything up.